Hello and welcome for an online study of fundamentals of anthropometry. Dear students, I have discussed in detail on chapter 1 based on introduction to anthropometry and definition of anthropometry. We will deal with chapter 2. Chapter 2 is based on basics of anthropometry. Myself, Professor Dr. R.P. D'Souza. In today's first session A, we will discuss about the nutritional assessment, importance for nutritional assessment. This chapter deals with an overview of anthropometry and its importance for nutritional assessment. This is to explain the key concepts of nutritional assessment. Why does nutrition matters? What are common uses of anthropometry? Commonly used anthropometric devices, measurements and indices, and finally anthropometric interpretation at individual level. Well, why does nutrition matters? A good health, good growth, good development and economic well-being of all individuals and populations is dependent on proper nutrition. When an individual has inadequate or excessive or imbalanced food intake that is not recommended as per his or her nutritional needs, the arising condition is termed as malnutrition. Malnutrition means bad nutrition. Nutritional aspect is why of much importance in anthropometric assessments. Well, here you can see an image of nutrition. Nutrition of different people or different cultures, it differs from culture to culture, but it has to be a balanced diet. Balanced diet in itself is a separate chapter in human physiology, where you will have to study the food components and the balanced diet. The balanced diet is related to anthropometry in terms of nutrition, because we assess the anthropometric measurements based on balanced diet effects. Balanced diet, grossly it is divided into 4 components. The major component 40% is fruits and vegetables, but we need more protein, fats and carbohydrates. The 25% requirement of carbohydrates, 25% requirement of proteins, and finally we require less fats of about 10%. This makes a balanced diet of an individual. This image will explain you all about a balanced diet required for fit, nutritionally healthy person. Now, what is malnutrition? Basically, malnutrition is a serious public health issue. It contributes to high rates of maternal and child illness and mortality. The child mortality and maternal mortality with different illnesses are caused by malnutrition rather than other causes of such illnesses. The malnourished individuals are less likely to achieve their full potential in terms of education, economic productivity. Therefore, they earn less income than well nourished peers of their same age, making it difficult to break the cycle of poverty. If the society or any country is poor, we say by poverty, the main reason is malnutrition. According to World Bank data, if a high proportion of a country is malnourished, it may affect the GDP of that country. And GDP means gross domestic product, and it affects by as much as 3%. So much of importance is there for nutrition. Hence, especially in a country like our India, addressing the malnutrition is essential to promote development, and measuring nutritional status is crucial to identifying individuals who need nutritional care and support. Then and then only the GDP of our country will rise. Nutrition has got many roles to play. There are many factors which affect the nutrition. Hunger, famine, or children who starvation, even education, homeless children. There are many factors which are responsible for malnutrition in any country. Here in this image you can see three major effects of malnutrition. Basically, 1 in 3 people all over the world, they are affected by malnutrition, and they come in different shapes and sizes. Basically, 3 effects we see. One is stunting, other is wasting, and the third one is obesity. A person too short for the age is termed as stunting, and a person who is too thin for the height, that is called as wasting, because muscles get wasted, and person whose weight is too high or overweight, such people are called as obesity. So, stunting, wasting and obesity are the 3 main malnutrition disorders. Nutritional value is of much importance right from the childhood age. Malnutrition also helps us to achieve an eagle's eye view of the nutritional status of a community, be it at the level of primary health center or at the national level itself. The much care has to be taken at the PSCs, primary health centers across the country. What are the main types of malnutrition now? As we saw in earlier image, we saw 3 disorders due to malnutrition: stunting, wasting and obesity. But basically malnutrition are of 2 types. One is undernutrition and other is overweight due to overnutrition. In undernutrition, there is micronutrient deficiency also. So, the stunting and wasting, they come under the heading of undernourished people, whereas obesity is caused due to overweight, and that is higher or say heavy nutrition. So, it is a both way, less is also problematic and more is also problematic as far as food intake is concerned, and that is what is called as nutrition. Now, let us discuss undernutrition. Undernutrition is a consequence of inadequate nutrient intake and or inadequate absorption of the food which is consumed, and or such illnesses or diseases which cause undernutrition. Undernutrition increases the risk of illnesses and it may lead to even death. For example, 45% of deaths of children under 5 across the globe are attributed to various forms of undernutrition. The percent is very high in under 5 children, and the main cause is undernutrition. All those underdeveloped countries or poor countries, they are facing this problem much as compared to the developing countries and the developed countries. A person's immune system is also impaired by poor nutrition. Immunity is required to fight against the disease. The poor nutrition will make him or her more susceptible to illnesses and infections and are less likely to heal faster. So, whenever any person comes to a doctor, along with the medications, there is an advisory regarding proper nutrition during the course of that illness. Undernutrition at an early age may also affect a child's physical, mental and socio-economic growth, leaving that child vulnerable to a number of problems in the future. So, there is a specific diet recommended for the children, especially under 5 children. The major types of undernutrition which occur alone or in combinations, those are acute undernutrition, chronic undernutrition and micronutrient deficiencies. In acute undernutrition, the person suffers from wasting of the muscles, thinness, body becomes thin, and it comes along with bilateral pitting edema. You are going to study this in detail in the various age categories in follow through programs. Chronic undernutrition will lead to stunting, height does not improve, and underweight, a composite of stunting and wasting together. The stunting and wasting together is caused due to chronic undernutrition. So, poor nutrition for a long period will cause these two disorders. And the micronutrient deficiencies such as deficiencies of various vitamins, deficiencies of various minerals will cause specific diseases, like we all know the vitamin C deficiency will cause scurvy, vitamin A deficiency will cause blindness, vitamin folic acid will cause mouth ulcers, iron deficiency will cause anemia. So, there are many other diseases, disorders which are caused by micronutrient deficiencies. Micronutrient deficiencies are assessed by using biochemical and clinical methods, and hence they are not done by anthropometric measurements, and therefore, these are not addressed in this subject, but they are related to nutrition. That is why we are considering them here. But for anthropometry, micronutrient deficiencies are not easily identified. Their assessment is by different methods, laboratory methods, invasive methods. There is one term called as marasmus. Marasmus is a severe form of malnutrition. Later on I will show you a picture of a child. Specifically, the protein energy malnutrition causes marasmus. It results from an overall lack of calories in the body. So, marasmus is a deficiency of all macronutrients. Macronutrients means proteins, carbohydrates and fats. So, proteins, carbohydrates and fats, if they are not taken adequately for a longer period, the person will suffer from marasmus, and it is more found in children, in poor societies, in poor countries. If you have marasmus, you lack the fuel in the body which is necessary to maintain normal body functions. So, there is a lot of weakness in that concerned person. Here you can see one image, an image of a poor child. This image will tell you the exact meaning of marasmus and the importance of nutrition basically for the under 5 children. So, different types of undernutrition we have already discussed, and they are to be related to a normal person, like wasting, stunting and more underweight and a normal person. This image will give you full idea about undernutrition and normal nutrition. Now, let us deal with obesity and overweight. This is another type of malnutrition. In the beginning I told you malnutrition has two types, undernutrition and overnutrition. On the other hand, being overweight occurs when a person has too much body fat and the person weighs more than it would be expected for a healthy person of the same height, and this puts the health of that person at risk. Too much of body fat is dangerous. In overweight, obesity is a severe form. Here a picture of a big boy, look at him, he has become totally round, and this is a obesity. We call such people as obese person, and they are found in all the ages. Mostly obese people are seen in highly developed countries or highly developed societies in our country also. So, in both way, poor nutrition and overnutrition, both need to be addressed in order to see that malnutrition is improvised, and that is going to affect the anthropometric measurements. Overweight and obesity are complex conditions. They are associated with multiple possible causes, including an imbalance between calories consumed and calories expended. When the person does not do any kind of exercise, physical exercise, where the calories are to be expended, and it does not happen. The calories are only consumed. There are low levels of physical activities in such kind of people, and they are affected by medical conditions also, even by genetics also. So, not only good nutrition, in some families there is a genetic and medical conditions which give rise to obesity. Overweight and obesity increases the risk of non-communicable diseases, including diabetes mellitus, it is a high sugar level in the blood, heart diseases including coronary heart disease, different types of cancers, and of course, even stroke, which causes paralysis or even unconsciousness or even coma or even a sudden death. Although undernutrition is still the primary concern in developing countries like our own country India, globally overweight and obesity are associated with more deaths than underweight, and this is according to the World Health Organization's statistics, WHO statistics. Obesity was once considered as an issue for high income countries. That means, highly developed countries had more obese people due to the high income, but now it has become an emerging public health threat in countries across the globe, including our country India. So, we are not spared from obesity. There are many obese people in India also, but it is attributed to higher income of that family which leads to obesity, and that is going to affect the anthropometric measurements. This has been creating a double burden of malnutrition in many developing countries that continue to have a high prevalence of undernutrition. Prevalence means there are possibilities of more. Here there is one picture, image, where you can see overweight and obesity related to body mass index. We are going to deal with body mass index now, how the body mass index is measured through anthropometry. We will see body mass index in next session, and we have to conclude now session A, which was based on basics of anthropometry and especially the nutrition and the effects of malnutrition. Well, look at this image. It is a medical infographic in order to study body mass index. The body mass index is called as BMI. Body mass index is measured by weight in kilograms divided by height in meters. All the people's body mass index is assessed in order to understand whether the person is normal or abnormal as far as his weight and height is concerned. What leads to obesity, or you can say extreme obesity, that need to be understood as far as the anthropometric measurements are concerned. You call person as a normal by taking his body mass index into consideration when this index is from 18.5 to 24.9. So, less than 18.5 means underweight. Here in this image you can see a person in blue color, the body mass index is less than 18.5. So, his anthropometric measurements will be of course different and they will be always less. If the body mass index is more than 25 up to 29.9, such persons are termed as overweight. So, there is still a chance to make him a normal if the proper advice and treatment is given to such persons, but the anthropometric measurements will be not normal. And when the body mass index goes from 30 to 34.9, such persons are termed as obese. Here you can see a person in orange color who is obese. And finally, if the body mass index is more than 35, such persons are termed as extremely obese. They are almost round and that is very dangerous. According to World Health Organization WHO, more deaths are caused by extremely obese disorders. So, underweight to overweight and finally to extremely obese, this range which is shown in different colors is very helpful to understand the mortality rate. Highly obese persons, they die early and the main reason of death is stroke, or they are affected by autoimmune disorders. That means without any infection they may suffer from cancer. So, timely anthropometric assessment and timely advice and the treatment can reduce the chances of mortality in such cases. This is all related to the nutrition, and this session is totally based on nutrition and its significance. So, finally, in order to summarize, nutrition and anthropometry are closely associated. Finally, we have a body, we measure everything. As we saw in chapter 1, we measure circumferences, we measure thickness, we measure weight, we measure height through different devices. For obese persons, we require skin thickness calipers. Of course, the weighing machine is more important, and nutrition, anthropometry, they together will lead to a diagnosis in order to give them a treatment and in order to watch the prognosis. That is why anthropometric measurements with the assessment of nutritional status, that is of very much importance for homeopaths also. There are different remedies available for marasmus, there are different remedies available for obesity. As I said earlier in early topic, that this is related to the constitution of a human being, and the constitution of human being is of prime importance. Based on today's session, the balanced diet or food as a whole, which is a separate chapter in human physiology, that has to be studied properly. All of you should know the balanced diet charts of different ages. Not only ages, balanced diet for different professions. Like professions include workers also, hard workers. So, those who are working hard physically, those who are sportsmen or sportswomen, those who are working sedentarily, balanced diet for professors, balanced diet for doctors. So, there are different charts which you have to study in diet and balanced diet, which is a separate chapter in human physiology. And through that, what food items are included in a daily diet of any person, that has to be prescribed. Of course, these people who get affected due to malnutrition, they will certainly come to us because they want a treatment, and in that case, when we assess their nutritional status with the help of anthropometric measurement, immediately we come to know that these people are so and so is suffering from undernutrition, which includes muscle wasting, what we call thinness, and the thinness, if it is not corrected at the right time, it will lead to a dangerous condition which we saw through previous image in a child, what is called as marasmus. So, one side is a marasmus and the other side is extremely obese. The food components which people consume, it includes vegetarian food, it includes non-vegetarian food. Sometimes some food elements are separately suggested for people based on the anthropometric measurement. As I said earlier, the micronutrient deficiencies, though they are clinically very much important, but here there is a limitation for anthropometry. We cannot assess those through anthropometry, and for that purpose we have to use biochemical methods, laboratory investigations, where there are invasive procedures. You have to let blood out and you have to analyze that. Through that we come to know the micronutrient deficiencies. So, along with anthropometry, we should know the other investigation methods in order to assess the micronutrient deficiencies. Basically, the food contents, they differ from families to families, societies to societies, regions to regions, and country to country. So, what actually the food is consumed, that is not a matter of question here. The matter of question is, what is the percentage of food ingredients? As I said earlier, macronutrients and micronutrients. The total food consists of proteins, fats, carbohydrates and minerals, vitamins and of course, water. So, whatever the people eat, we have to identify the deficient food ingredient and we have to suggest that. And food ingredients are available in the form of medications also. And apart from food intake, we have to do the differential diagnosis whether there is any other cause which has caused malnutrition apart from food intake. Like I said, there are genetical factors which are responsible for obesity which runs in their families. Even if they eat less, all of them become obese. So, those genetic problems need to be addressed over here. So, whether it is related to food or some other problem, that has to be understood. But in any case, anthropometric measurement will help us to identify these conditions. More problems which arise in poor people, people who live in villages, people who live in slum areas, their main problem is undernutrition. They have to work hard and they do not get enough food in terms of balanced diet in order to be a normal person. So, the intake of calories is less and more calories are expended through their hard work. And for that purpose, food for all has to be the major concern at the level of primary health center. There are different policies and programs of Government of India regarding the food intake issue which is related to the nutritional policy. We call it as National Nutritional Policy. Well, you need to understand nutrition related to anthropometric measurements, so that when you go for assessment, online assessment on this session, the minute things may be asked in terms of MCQs. So, you have to study nutrition and balanced diet again and again in order to answer those assessment questions. For example, obesity is caused by, whether it is caused by high intake of food alone, or there are other causes which makes a person obese. In that case, you get confused, and because this is a topic based on nutrition, we directly think of due to high intake of food, and there you may go wrong. So, I am repeating this again and again, and nutrition is related more in physiology and anthropometry is related more in anatomy. So, anatomy and physiology, they go hand in hand, and that is why they are to be studied in order to understand the anthropometry and anthropometric measurements. We will study more about nutritional disorders in next session, and for each session you will be assessed for 10 marks, because there is 1 mark for each MCQ. So, I advise you all to listen to this video again and again and try to understand it in order to score out of out marks. Of course, I am taking last session on chapter 2, and there are other speakers who are going to deal with the exact category of people. In that you will understand more about nutritional assessment and nutritional disorders. And I think that for basics of anthropometry, as far as the nutrition is concerned and nutritional assessment is concerned, which is related to anthropometric measurement, this is quite enough. And with this, I end my today's session on anthropometric measurements related to nutritional assessment. Thank you.